Bobby Scott, how you doing?
Hi, Bobby.
Hey.
Okay. Well, welcome everybody. Thank you for joining us this afternoon. Moments ago, we passed 70,000 fatalities in the United States from COVID. And in the month of April alone, roughly 30 million people applied for unemployment. Many of those who lost their jobs will also lose their health coverage in the middle of a healthcare crisis. There is a federal program that can serve as a lifeline for those losing coverage. It's called COBRA, and it gives people the option and the opportunity to keep their employer-based coverage. But like much of our safety net, that program is intentionally stingy. And you can keep your coverage, but you have to pay for it. You have to pay for your share of that coverage, and you have to pay for the employer's share. And for a typical family, we're talking about, upwards of $1,500 per month. Joining us this afternoon are two prominent Democratic leaders in the Congress who are trying to fix COBRA for this crisis so that the federal government covers 100% of the cost instead of 0% of the cost. Those two leaders are Illinois Senator Dick Durbin of Illinois, who's also the minority whip and has been a force on healthcare since his days in the House when he took on the tobacco industry. And also with us is Congressman and House Ed and Labor Chairperson Bobby Scott, who's had his fingerprints on really every important piece of legislation dealing with education and labor for the past 2 decades. And also with us are two experts on this topic, Jillian Berk, who has studied efforts to expand COBRA and works at Mathematica, which is a great organization, and Stan Dorn from Families USA, where he directs the Center for Coverage and Innovation. Thank you, everybody. Senator Durbin, I know you have limited time with us, so before we run out of time, let me start with you. You and your Democratic colleagues have been fighting for protections that would enable laid-off workers to keep their coverage through COBRA. 820,000 people have lost their jobs already just this month in Illinois. Nearly 600,000 people have lost their jobs not too far away in Kentucky, which is Leader McConnell's home state. So this is an equal opportunity job killer. What are the opportunities and challenges facing this effort in the Senate, given that it's hitting Republicans and Democrats on the economy equally?
Well, I can tell you that if folks are listening to the people who are losing their jobs, they'll know they're in a bit of a panic. I can't think of a worse situation than to be told your company's going to let you go and they have no choice. And you look around and you think, what's next for me in terms of feeding this family? So we ended up with our extended unemployment insurance coverage. We gave $600 more a week to try to make sure that it was big enough to take care of most, at least for the most basic expenses, realizing that we weren't going to match the salaries that a lot of people were making on the job, but try to keep them alive until this economy turns. And then came a debate in the Senate, one of the few real debates we had and votes we had, as to whether this $600 a week was a windfall. There were people arguing, Senator Sass from Nebraska was one of them, and a few others, who said, wait a minute, some people are going to come out ahead when you add the state unemployment benefit to the $600. And the honest answer is yes, that may happen. It may happen. But it is more likely that the $600 plus the state contribution isn't going to be enough to make a difference. And one of the things that was obvious is $600 a week sounds pretty substantial until you look at the average COBRA premium. If I lose my job and I want to keep that health insurance I had on the job for a lot of different reasons, I like the coverage. It's providing the right hospital, the right doctor for my wife, my son, my daughter, for someone with a special condition, then I've got to pick up the cost that the employer was putting on the table. That means in the average situation, $1,700 a month. $1,700 a month against $600 a week. You do the math and you say, well, you just netted out $700 in this federal bonus if you're going to pay the COBRA side of it. So we look at it and we think picking up the COBRA cost is the best way to make sure people have continuity of coverage, peace of mind, the kind of hospitals and doctors they've been working with for some period of time. And that's why Congressman Scott and I are kind of pushing this concept. Take a look at what the options are when you lose your job. They're pretty basic. You can enroll in an Affordable Care Act plan if you qualify, and most do. It may change your insurance company, your providers and such, and for some families that is problematic. You could eventually, if you're off of work long enough, and I hope you aren't, but you might be, qualify for Medicaid, or you can go this COBRA route. This is not a perfect answer, but it is the right transition answer as far as I'm concerned. Keep in mind that the categories that we're talking about here of assistance during this crisis are pretty limited, and they have a deadline. We anticipate under the small business loan that you will be finished with your loan and your payment for payroll and benefits and such by June 30th. We anticipate under the unemployment that we'll pay until July 1st. Well, think about those two dates, June 30th and July 1st, and ask yourself, are we going to be out of the woods by then? Well, I hope we will, but it'll be a miracle. Instead, we're going to see this economy start to move forward as we start to reopen and people start going back to work. What Bobby Scott and I are trying to do is cover that cost of the health insurance you had at work until life gets better and more predictable, and there's another source of benefits for you that you and your family can count on. So that's what we're up against. I hope we can get support, bipartisan support over here. The alternative is an awful lot of people who are just not going to have basic health insurance coverage. So that's where we stand at the moment. We are hoping to make this part of the next big bill, which is, I believe, I've heard, is going to originate in the House soon. And that may be the cue for Bobby to step in and tell his side of the story, which I hope is the same one I just told you.
Great. Thank you, Senator. I just want to say to our audience on the Zoom call, you can ask questions. Just move your cursor over your screen. A box will come up. It allows you to type in a question, and I'm going to ask some of the opening questions, but then I want to take questions from the audience for our guests. Chairman Scott, you are the author of the House legislation to make COBRA free for the duration of the pandemic. 570,000 Virginians have filed for UI since March. In neighboring North Carolina, and I mention that just because there's the ranking Republican on your committee is from North Carolina, the number is 750,000. This seems pretty important no matter where you live, what party you identify with. This disease doesn't really seem to care. This bill, the next package will originate in the House. What do you see for the prognosis of this? What do you see as the obstacles for this? And you're on mute right now, and I don't know if that's you or us.
It was me.
You're good.
Thank you, Jim, and thank you for your good work. Thank you for your good work on Third Way, and I want to thank Dick Durbin for his good work on this bill and a lot of other bills over the years. You've already pointed out the fact that 30 million people just in the last couple of weeks have filed unemployment, and we know that those who lose their jobs, a lot of them lose their insurance. We're reminded of the problem with associating your insurance with your job, but that's the way it is. COBRA protects people when they lose their jobs. They can keep their insurance, but as you pointed out, they have to make the payment. And if you've lost your job, you don't have $1,000 or $1,500 a month, and many people will just have to go without. The Workers' Health Coverage Protection Act, introduced in the House by me and Steve Horsford and Debbie Dingell, would cover the full cost of the COBRA payment. It would cover you if you've been laid off, if you've been furloughed, or even if you've lost hours and makes you part-time ineligible for health care, it would cover that too. It's based on the experience we had in 08 and 09 when we had legislation that covered 2/3 of the cost. And we learned then that 2/3 wasn't enough because most of the people who'd lost their jobs don't have the 1/3. And so that's why the decision was made to subsidize the full payment. Senator Durbin has indicated the value of it. You get to, if you don't do this and you go into the marketplace or get Medicaid, or if you just go uninsured, go to the hospital, don't pay, your costs get cost shifted on everybody else. So there is a cost in not doing anything. But if you have to get other insurance, you will probably end up with a different provider network, so that you have to lose your doctors. You may have to start your deductible all over again, which is an insult. And then 3 months later, when you get your job back, you have to say goodbye to your new providers. You get your old providers back, and lo and behold, you might have to start the deductible all over again. And so that's it makes a lot more sense to let people have the continuity of care. We're in the middle of a health pandemic. The last thing people need to worry about is their health care coverage. And this provides one less thing that they have to worry about, going back and forth in and out of insurance, whether they can afford it or not. They will have health insurance. There are a lot of other things we need to be doing, and we can go into that if we have time. But we need to make sure that this one worry is taken off the plate. People who had health insurance won't lose it if they lose their job.
Jillian, Jillian Berk, you studied this in the past at Mathematica, and as Chairman Scott said, Congress went 2/3 of the way. They said, okay, we're gonna cover the employer share of people's COBRA. They're gonna have to cover their own. But you also found that, and probably in part because you have to cover 1/3 of it, the uptake wasn't that great. What did your study find that kind of can give insights to how this should work better this time?
Thanks, and thanks for inviting me here today. The Department of Labor asked Mathematica to fill in a lot of the knowledge gaps around COBRA coverage and this COBRA subsidies, because it was a really big change in policy, and we wanted to understand who was able to take advantage of it. And I think we learned a few important lessons that we should keep in mind as we think about policy today. The first is that we found that less than 1/3 of eligible individuals were even aware of the subsidy. So these were individuals that had filed for unemployment insurance. They had employer provided coverage when they lost their job, so they were COBRA eligible, and they just weren't aware of the subsidy. Employers were required to notify individuals, but those notifications are very complex, very written in legal language. When you've lost your job and you're trying to figure out how to pay the bills that are coming in and all the stress, you're not necessarily processing that notice that you get from your employer about COBRA. And we also found that, even with the 65% subsidy, COBRA was still too expensive for most of the people who were eligible. And as you would expect, we saw that COBRA take-up was higher among the more advantaged workers, workers who had higher earnings prior to job loss, workers with higher levels of education. We did find that the subsidy increased COBRA take-up by 15%, so there was an impact of this subsidy offer, but the impact was much smaller than you might have expected if you asked individuals a series of hypothetical questions. If we cut the price of COBRA by this amount, would you have taken it up? If you cut the price of COBRA by this amount, would you have taken it up? At a 65% subsidy, people think that they would really take advantage of that subsidy and that it would really change their behavior. We didn't find that impact, and I think it's probably a combination of that lack of awareness of the subsidy, and that at the end of the day, there are a lot of competing expenses, and that remaining COBRA amount was just too high. So I think those are some of the top line findings. Happy to talk more after we get to hear from Stan.
And so Families USA has really been at the forefront of expanding healthcare for people for as long as I can remember. And I think for outside groups, they did more to pass the ACA than just about anyone else. So I just want to give kudos for you and Families USA for the great work you've done. You've looked at this also, both at families and in a previous job at Urban Institute. You looked at healthcare tax credits, you looked at uptake. What is it that you found that you think is a lesson that can apply here?
Well, thank you, first of all, Jim, for those kind words and for inviting me here today. And it's an honor to be here with Chairman Scott and Senator Durbin and Jillian and you. And thank you for the great work that you all have done. When we looked at the health coverage tax credit program, it was enacted in 2002 as part of the Trade Act, and it was intended to help laid off workers and early retirees. Like the COBRA subsidies in 2009, the healthcare tax credit program, HCTC, covered only 65% of premiums. The take-up rate was 10 to 20%. The surveys that were done of laid off workers and of early retirees track perfectly with what Jillian found a few years later in the COBRA subsidies and the Recovery Act. Namely, cost was a huge barrier for people. But the other piece of the story was complicated to sign up for coverage and confusing to sign up for coverage. COBRA was one option. There were also other options. And there were a few times, and in fact, just to circle back to the point that Jillian made about people not understanding despite getting the COBRA notices, even people who had gone through in-person briefings at their one-stop centers didn't retain the information that they were given. The only time we saw significant take-up with the HCTC program was when unions or government officials provided intensive one-on-one help to the laid-off workers and their families, helping them understand the situation, what the programs were they were signing up for, filling out paperwork for them, being troubleshooters, diagnosing problems. It was intensive, but it wound up raising the take-up rate from 10 to 20% to 50% or more. Just an incredible impact in a very flawed program. And one of the most important take-home lessons is people who've just lost their jobs are overwhelmed with the emotional effects of job loss, the practical consequences of needing to figure out, what is this unemployment insurance thing? How do I get it? Looking for a new job, maybe dealing with the SNAP program. It's just overwhelming. And people do not have the bandwidth to sort through a complicated health coverage system and complete paperwork and sign up. Some do, but a lot don't. So as Congress moves forward, and I have to say the bill that Chairman Scott and his colleagues have introduced is really fabulous in addressing some of these problems. It takes an unaffordable premium and covers it for people. And for those who are affluent, instead of doing means testing up front that slows enrollment into coverage and will often stop people with procedural red tape obstacles, instead of that, the bill really brilliantly says when you file your year-end tax returns, if you make more than $250,000 a year for a family, then you have to pay back some or all of the subsidies on a sliding scale. You know, industry was originally saying, well, maybe we should have a 90% subsidy. And I really commend Third Way and Chairman Scott for stepping forward and saying, you know, that is not really going to be enough. For somebody with a family plan, that's even if you pay just 10% of that premium, on average, that's $171 a month. Well, if you're trying to figure out which bill you're not going to pay this month, is it the utility bill? Is it your car payment? Is it your mortgage? $171 is a lot of money, and we know what's going to happen. People who don't have much money are not going to pay it. People who are healthy are not going to pay it. The only people who are going to pay it are those who are really having serious health problems, and they'll come up with the money, particularly if they have it sitting around. That is not the road we want to go down, and I just think it's really terrific that Chairman Scott and that Third Way and Senator Durbin are moving forward with something that really makes coverage affordable for people who are really scuffling and having tough times.
And even that payment plan, it just adds a new complication and a wrinkle that says, I've got to fill out this and that. And the more you make this complicated, at this point, you certainly want uptake to be at its maximum. For Senator Durbin, if he's able to answer before leaving, and also for Congressman Scott, this is a question from the audience. And why would any Republicans oppose this? I'm taking a couple of questions and putting them together. Why would they oppose this, other than either they just don't want to help people, or they just have this view that government shouldn't be more involved in healthcare? People in their states are getting decimated by this and losing their jobs.
Okay,
Is this a real hurdle?
Okay, I'll put the cards on the table here. We're among friends, I'm sure. And I'll be pretty blunt about this. If you look at the options available to unemployed people and the Republican position, publicly stated position, here's what it comes down to. If the option is signing up for Obamacare, they hate it like the devil hates holy water, so they don't want unemployed people to do that. If the second option is adding them to a Medicaid program, 14 Republican-led states have refused to expand Medicaid coverage over the last 10 years, so they don't like Medicaid either. The third part of this thing, continuing through COBRA, the existing health insurance, the red flag there is right to life and the abortion issue. In 4 states, California, New York, Oregon, and Washington, it is mandated that health insurance policies include abortion services, okay? So if you happen to have employer-based health insurance in those states, your plan already covers abortion services. Now, if you lose your job and COBRA, the federal government, is going to step in and pick up 100%, those who oppose abortion say, wait a minute, you're asking me to pay for abortion services, won't do it. So we're kind of stuck on this issue, which comes back time and again, abortion, Hyde, and all the rest of it, on the third option. So I've given you the 3 avenues of Republican opposition. I hope we can work out the third one, 100% COBRA reimbursement, and some sort of an answer that satisfies those who are concerned about funding abortion services. But that's what it comes down to.
That is how you dance on the head of a pin. Chairman Scott.
Well, I think you have to point out that a lot of Republicans, in fact, do support the legislation. The Chamber of Commerce has indicated support. So there's broad bipartisan support. When you get caught up in the issue of abortion, it's more sound and fury than substance. If you funded all except the cost of the abortion coverage, it's hard to find what you're talking about. We had, under the Affordable Care Act, we went through all these jumps and hoops. If there's abortion coverage, it has to be separately billed, and the legislation requires it to be at least $1. We have not found a single insurance company that has charged more than $1, because essentially it's the same price. So I mean, what are we talking about in terms of subsidy? I mean, the rhetoric involved greatly exceeds the appropriation. But in any case, there is broad bipartisan support for the legislation, including the fact that the Chamber of Commerce has indicated support. So I hope we don't get tripped up over something that you can't even quantify.
Jillian, do you think that if the plan is free, 100% minus $1, that from your study that the uptake rates will be close to 100%, or do you think more needs to be done based on what you saw in your study? And Stan, I'd like you to answer that too.
Yeah, I think the short answer is no, not everyone will take it up. If the only notification about the subsidy comes in the form of a letter from their employer. I think that's not enough. If it's combined potentially with a public outreach campaign, or maybe the 100% will just be a clearer message for people. But I think we've learned that having employers send a letter is not going to be sufficient. I think the other thing is just health insurance is confusing, and what's getting subsidized? Is it their premiums? What does that mean about their co-pays? The language of health insurance is just not a language that everyone is comfortable with. And so I think it's going to be important to have really clear communication about what this COBRA subsidy does for people.
Yeah, totally agree. Raising the amount of the subsidy will be critically important. And by itself, that will get a lot of people signed up and insured. But It is confusing. People are not focused on it. I mean, if you look at Google searches of the last few months, health insurance Google searches haven't gone up. People are focused on other things. And just picking up on Jillian's point, I think even if you do outreach and public information, that is not really going to sink in the really tough world that people are facing who've just lost their jobs. If you really want to reach these folks, you need to have a major campaign of consumer assistance where people who understand the system are working one-on-one with those families. Costs money, but that's what you need to do if you want to get people to keep their health insurance or move to other forms of health insurance. That's why we at Families USA are calling for Congress to do a mandatory appropriation of $600 million to make sure that we do not get overwhelmed by a tsunami of health insurance losses in the coming months that will just compound the existing pandemic and recession.
Let me take a couple of questions that are from the audience and just kind of combine them. And for you, Congressman Scott, and I don't know if Senator Durbin is still on the line now or not.
Yeah, I'm still here.
Okay, terrific. What does this make you think about the reforms we need long-term for healthcare here? You know, this is certainly a real jolt. You know, what needs to be done?
We got to get real about this. I mean, if we had any question about a safety net, including affordable, quality health insurance, I hope those questions are gone now. We're all so damn vulnerable out there, every one of us. And if the federal government doesn't say the test is free, the vaccine's free, the complications and all the hospitalizations that follow when you start talking about the numbers we're talking about here would wipe the average person out in a second. I mean, it's a fact. And you can argue, some argue make it Medicare for all, some argue keep it in the marketplace as Obamacare tried to do. We better find an answer that gives people satisfaction and peace of mind, and the current situation does not.
I think he's exactly right. We've been reminded of the problem of associating your health care with your job. When you lose your job or you change jobs, your health care goes along with it. But as Dick said, there are a lot of other things we can be doing in this legislation. And he mentioned the fact that we have passed in previous bills in the last few weeks, the fact that you can get a free test, no copay and deductible, a free vaccine when that's available, no copay and deductible. And what we need is treatment. This is a random thing. A lot of people are not going to get infected, some infected, no symptoms all the way through, some mild symptoms, some severe symptoms, and some are going to be hospitalized with massive hospital bills that would bankrupt the average family. The treatment for COVID-19 ought to be covered as a government expense, so that you don't get into the situation with insurance companies covering a pandemic that wasn't part of their analysis when they set the premiums. We can encourage states that haven't expanded Medicaid to expand Medicaid. The cost of the state, this is ideological, it's not arithmetic. The cost to the state is almost negligible. In Virginia, we have a 6% income tax and 6% sales tax. There's a 90% match. So if you give a doctor $1, he's going to give you 6 cents back in income tax and go spend it 6 more cents in sales tax. You got your money back before you've done anything. Before you get to the fact that if you got a state hospital where somebody didn't pay, they just didn't pay. If you hand them a Medicaid card, they paid 90% of the bill with money you didn't have. I mean, most states will make a profit expanding Medicaid, so you can't say that that's all ideology. It has nothing to do with expense. We need special enrollment periods. When people, this is a new situation. A lot of people goofed off and didn't sign up for insurance. Well, let them get into insurance policy now in special enrollment. We need to strengthen subsidies. We subsidize the policies up to a point and then stop right at the cliff. At Family of Four, it's about around $100,000. You make just over that, you got to pay full sticker price. There's no reason why we can't say you're going to pay 9% of your salary forever. At some point, the 9% is going to exceed the sticker price, so it doesn't matter. But you've got a lot of people in that gap that that cannot afford a family policy that could, if you extended the percentage all the way out. You need to end the sabotage of the Affordable Care Act. The lawsuit in Texas that could find all of the Affordable Care Act protections for pre-existing conditions, all of the subsidies, everything else unconstitutional for some reason. That case is going on. The availability, creating association health plans, which pull out healthy groups so that everybody left behind pays more. We need to discourage or end those policies. There's a lot of things that we can do, but the main thing, as Dick has said, we have to make healthcare available to everybody so that when you have a pandemic and you have a lot to worry about, your health insurance isn't one of them.
Bobby, let me add one footnote to that. If I can add one footnote to that, here's what we've learned. Politicians can stop coverage of health insurance by the laws they write. Politicians can't stop a pandemic. This pandemic doesn't give a tinker's damn whether the politicians in Washington want to exclude or include a certain group. We are all vulnerable. When we say that there's a segment of America, we're just not going to cover them. We shouldn't have to cover them. We're not going to cover them completely. We're only going to cover them partially. Guess what? That's your neighbor. That's the one standing next to you on the bus. That's the person that you work with. That's the one who's got a kid sitting next to your grandson in school. And you say to yourself, you cannot deal with public health unless you deal with the public. And that's everybody. We've all got to get under the same tent.
That's exactly right. This is truly not theoretical, but practical. We're all in this together. I want to make a quick plug for Third Way's healthcare plan, which covers everybody through Obamacare and caps everybody's out-of-pocket costs, no matter where you get your insurance, whether it's on the exchange, whether it's Medicare, Medicaid, or through your employer. Stan, you've been working on the healthcare issue your entire adult life. What has this made you think in terms of going forward?
Well, I completely agree with everything that Chairman Scott and Senator Durbin have been saying. We have to make healthcare a lot more affordable for people, and we have to make it a lot easier for people to enroll. We have to make sure that our government agencies that are running these programs have the resources they need to do their jobs. I mean, it's just appalling. People cannot get through on the unemployment insurance websites. The IRS isn't able to get checks out for dependents until next year. I mean, it's just, the Medicaid agencies have been told by the federal government that it's okay. They can disregard the normal timelines for processing applications. They can tell people in the middle of a pandemic, oh, you just sit and wait. It's okay. You won't get health insurance to you for a while till it takes our time to process those applications. We have to fix the mechanisms, the machinery of government. We're now learning that we all may wind up being dependent on those government agencies that have been starved for funding under the current Senate majority. I think that the things that were said a few minutes ago are exactly right. The only other things I would add are there was a really important set of provisions inside the Taking Responsibility for Workers and Families Act, really wonderful, wonderful bill that members of the House introduced as the CARES Act was going through the Senate. And in addition to helping people above 400% of poverty, $100,000 a year for a family of four, that legislation borrowed bipartisan provisions of Massachusetts that state had used effectively since 2006 and said, you know what, if you are poor or near poor, you don't have to pay anything for premiums. And instead of asking you to pay $100 a month if you're just above poverty level, we're going to cut that down to $40 a month. They made it so much more affordable for people. We need that under any circumstance. Most of the people who are uninsured and eligible for help are in the lower income range, because the ACA, as wonderful as it is, and thank God it's there, otherwise we'd have millions more uninsured, it didn't provide enough help for people. And I'm hoping this will be an opportunity for us to step back and say, let's fix this right now for the people who are struggling and having difficulty, but let's fix this in a way that lays the groundwork for something better down the road. And the other thing.
Oh, sorry.
No, it's okay. It's okay. I'll just stop.
Jillian, your Mathematica study really made it apparent that where the people were not getting their uptake, it was by far the most vulnerable people. It was the people at the lower income levels, and it just seems to be that this is a call for just making sure people are covered in a way that is you know, keeps complicated proof from that.
Right. And I mean, the other thing to highlight is there's only about 40% of the people who are filing for unemployment that were even eligible for COBRA, right?
Exactly.
Because the other people didn't necessarily have insurance through their job. Some of them may have had another form of health insurance coverage, but there are a lot of vulnerable people that are going to be without health insurance during a pandemic.
I'm going to ask for Senator Durbin, if he's still on the line, and Congressman Scott. I'm going to two questions from our audience. I'm going to kind of combine them into one question, and it's really about congressional action. The one is the solution on the COBRA plan to cover 99%? And would that, because of this abortion ridiculousness? And the other question that's related is, before COVID, we were having a congressional debate on other healthcare issues like drug prices and surprise billing. And what is the possibility for those at this moment? Do these get pushed to a back burner, or does that come into play on this?
I'm going to go first because I have to leave, Bobby. If you could just I'll make it very brief if I can. I don't know if 99.9% is the answer to this. We've done sillier things in the past. If that's the cost of getting this done, then I'll swallow hard and take it. Just speaking for myself and not for any Democrats other than myself. The second thing is we were tied up in knots before the COVID virus over the question of surprise billing and whether we're ever going to get back to it. And it was the only element of real reform that we thought had a chance in this divided Congress. The House has done good work on a lot of different issues that just sit on Senator McConnell's desk when it comes to health care reform. In the Senate, we were down to surprise billing, and we had reached an impasse on that. So what do I think about the rest of the year? Not likely. We're not doing any substantive business now as we meet. We're just barely limping along, approving some of Senator McConnell's favorite judges. So I'm afraid that's the extent of what we've been able to do. I'm going to have to jump off. Thank you for letting me say my piece on this. I enjoy Third Way's approach.
Thank you so much.
Thank you. Thank
Congressman.
you, Dick. Dick is the whip over in the Senate, so he's counting votes on surprise billing, and they need over in the Senate 60 rather than a simple majority. I think surprise billing, we were actually fairly close on. If we had continued working on it, I was optimistic that we could come to some kind of conclusion. But in this situation, where you've got doctors coming not only out of network, from out of state practicing, there's no telling what kind of bills they're going to lob in. And it would be nice to have a surprise billing protection. It's my understanding that Medicare is not recognizing surprise bills. They're going to pay what they're going to pay, and it's up to the doctors to take what's going on. And I think the administration has said under the CARES bill, they have administratively decided that they're going to pay kind of average in-network fees and not what people ask. So I think there's a lot of agreement that the surprise billing is unfair and needs to be dealt with. I have the same attitude on the abortion question. If you're talking about 99.9% subsidy rather than 100%, there's old adage, you don't want to make the perfect the enemy of the good. Well, 99.9, that's what it takes. There's another thing that just generally we need to do, we don't want to ignore, and that is at some point we need to gradually get to the point where we get out of all these minutiae about how you get your health care and get to a Medicare for all. I don't believe you can get there in one jump, but certainly the House passed Obamacare bill included a public option, so that if we're right, that would have absorbed a significant portion of the market share and given the benefits of Medicare for all. Even if you never got there, people would get the benefits of Medicare for all. But we need to be getting to the point where we get a lot of the administrative expenses and reduce the administrative expenses and get to a more global availability of healthcare without having to jump through hoops when you lose your jobs, go through this portal or that portal. At some point, we need to just calm down and have a simple solution so where people don't have to worry about their health care. Medicare for All is one way. Public option on the Affordable Care Act, I think, is clearly another, particularly if you let employers start buying into the Affordable Care Act marketplace where they could purchase the public option. I remember when it was first suggested, a sitting United States senator said that, wait a minute, the public option would constitute unfair competition. Well, what does that mean? That means that they could provide a better product at a lower price, and that's unfair. Well, if he thinks he can do it at a lower price, better product, it's time to just call the question, let's vote. That's what you want. And so I think we need to be looking at those proposals as well, but that's further down the road. The initiatives I talked about are things that I think have a reasonable chance of passing, in the next few weeks. But long term, we need to be looking at something that makes healthcare available to everyone. At some point, not at a price, because everybody needs healthcare, and just make it a societal cost, just like what happens when you turn 65.
Thank you so much. It's clear that we have to end the era where the availability and the affordability of healthcare is a vulnerability for people. It just needs to be something that they can clearly afford and that they have, and that they just, that nagging worry just needs to disappear with folks. We have reached the end of our time. I want to say thank you to our guests, Jillian Berk, Stan Dorn, for their outside expertise on this and their advocacy as well, both academic advocacy and organizational advocacy. I want to thank Chairman Bobby Scott for critically important legislation that has to be done, and Senator Dick Durbin as well. This absolutely needs to be done. This is a must-have, not a would like to have. And I would like to thank everybody on the Zoom call who was able to join and ask questions. Thank you all so much.